our promulgation of the current version of our medical marijuana rules. And also with regard to our rules that are currently pending, we have implemented all of the acts from 2023. We have one rule that's outstanding. It's going to be presented in Public Health Committee for the legislature on Monday, and then it will be further submitted to the ALC Rules Subcommittee for review and approval in November. And then after that, we can file the final rule and have it filed before the Secretary of State. So all of our rules will be finalized that are implementing all the 2023 acts. And of course, we have a new session coming up in 2025. We often have health-related acts that we have to implement. And so we will be following all of the bills that are filed. We'll review all the bills, particular attention to the ones that are health-related and state agency-related. And we will keep you all updated after the session. We usually have a summary of all the health-related acts, and that's what our staff uses to help implement any rules. So I'm happy to take any questions.
Laura, so now I really voted yesterday. I did notice that the medical marijuana, it was the third ballot measure for the state of Arkansas. Is that correct?
Right. But
You're saying it's basically adult. Okay, that's what I thought.
Mm-hmm.
I just wanted to make sure. I have had people come up to me and ask about it, and I haven't been 100% certain.
Right. It was still on the ballot just because of the decision making was made after the ballots were produced.
Okay, that's what I thought. I just wanted to make sure because I'm actually fighting a local issue right now, and people, I guess, come up to me on other issues, so I want to make sure I was qualified to tell them that. Okay, thank you.
So that means leave it blank ballot.
Of course, you all can do whatever you want. Well, there's no other questions. I appreciate it. Thank you.
Laura, you're the team, and I mean this sincerely. Y'all do an awesome job for us and for our state and all that we do, all the legal proceedings and everything that we do. We appreciate that.
Here, here.
Go ahead and have my team stand up. If I could have my team stand up, as you, Rogers.
Why don't you introduce who all, some may not know who they are.
Sure. You all are probably familiar with Reggie Rogers, our Deputy General Counsel.
I would stand up. I'm too old. I didn't even know you were here. I hadn't heard of you.
Oh, he's been here.
We have Jessica Church and Carla Locke. They serve as well as our benefit. Deborah Reagan, she is our latest hire. We're very fortunate to have Deborah here, our attorney. We have Craig Smith and Brian Nichols. Serve as our Medicaid provider appeal, administrative law judges, and they also have other duties as assigned, which oftentimes takes up a lot of their time. And we also have Chuck Harden is here, and he serves as our ADH privacy officer. Thank you for the opportunity to introduce them.
Thank you, Laura. Okay, let's go to new business. We're there. Am I missing something? Oh, that's right. You've got another presentation.
I do.
I'm sorry.
One rule, this will require a vote. This is basically an update to the rule pertaining to dental hygienists serving underserved areas. And you all may remember this from last year. You've already approved the concept. The rule was moving forward through the process. We have several steps in the process, and after public comment and after the review and approval of the legislative committees, we realized there were a few technical things that the legal team missed. It's on us. And so we wanted to make sure that you all saw the amendments to the rule as it went through the process. So on page 3 of your packet, you can tell there's the underlined words patients was added, and also individuals with intellectual or other developmental disabilities. So we just wanted to make sure that those substantive changes were noted by the Board of Health before we filed the final rule. So this will require a vote. I'm happy to take any questions.
Seeing that in her presentation, so we have a motion to approve them.
I so move.
Second. Mr. Reagan. All those in favor say aye.
Aye.
Any opposed or abstaining? It's approved.
Thank you.
Thanks, Laura. I'm sorry I missed out on that. I was too involved in the legal aspect. Okay, let's go to new business, and we have county health officer appointments. And Mr. Hurd.
Good morning, everybody. Pleasure to be here again before you. As you all know, we have a county health officer in every county who serve and on a voluntary basis without any remuneration from the department as our arm in the county, helping with various activities and efforts within the state. Some of you had the opportunity to meet some of them at the symposium earlier this month. And thank you for those of you who were there. I've heard from several of the county health officers how much they appreciated having the Board of Health members there and how much they enjoyed the interactions between the two groups. So hopefully we'll continue that for future years. I'm here to ask for your approval for the appointments of two new county health officers. One in Jefferson County. You have two letters, one from Judge Robinson, the Jefferson County judge, and also a letter from Lakeisha Webb Collins, who is our administrator for our local health units in Jefferson County, both of them endorsing the nomination of Dr. Tony Middleton. Dr. Middleton is going to be taking over the remainder term of from Dr. Horace Green, who resigned earlier because of health concerns. Nurse Webb Collins at the local health unit says that Dr. Middleton has been working closely with the health department over time, is very familiar with the health department, and has been a great asset in providing very much needed care in the county. Dr. Middleton is a board certified in family medicine. She graduated from the University of Arkansas for Medical Sciences and also did her residency training at UMS at Pine Bluff, and that's, by the way, is where she's been a lifelong resident. She is a current member of the Arkansas Medical Society and American Academy of Family Physicians, and is currently the program director of the UMS South Central Family Medicine Residency Program. So, and you have her CD there for more information if you'd like to look at that.
And we'll do these one at a time at this point. So those of you that are supporting Tony Middleton, I need a motion and a second.
I'll make the motion to approve.
Yeah.
I'll second.
All those in favor say aye. Aye. Any opposed?
The second nomination is from Saline County. Again, you have a letter from Judge Matt Bromley, as well as a letter from our local health unit administrator, Karen Mays. And this is to nominate Dr. Jeff Mayfield as the Saline County Health Officer. And Dr. Mayfield is replacing Dr. Kara Ballard, who resigned sometime in 2023. And we're happy to have found a replacement for her. Dr. Mayfield, also a graduate of UMS, and also did his residency in the Department of Family and Community Medicine. He's board certified in with the American Board of Family Medicine, and currently works at the Benson Family Clinic.
So you've heard that and read it in your packet. Need a motion to approve it.
I'll
Make the motion. Sorry.
I'll second it. I do know Dr. Mayfield both professionally, personally, so.
Good. Dr. Riddell, you gonna second it?
I'll look at it.
Okay. All those in favor say aye.
Aye.
Any opposed? And Dr. Drury, thank you for the symposium that's had. I'm going to comment on that in my remarks.
Thank you very
Yeah,
much.
that's good. All right, let's move along here to massage therapy technical advisory committee appointment. Kelly, go ahead.
Good morning, thank you for your time. I came in July to have our committee members appointments, and one of them dropped out, and so I'm coming back with the seventh member of the committee. Her name is Deborah Thompson, and she is a licensed massage therapist and has been for 27 years, and we just need approval for her appointment.
Motion to approve.
I'll move for approval.
Second.
Dr. Zini.
Good. All right, all those in favor say aye.
Aye.
Any opposed? All right. Okay, Shane, David, it's gonna be on board for a little bit. You got several.
I do. First of all, before you have the proposed listed amendments to the controlled substance list this year. I can go through these and kind of clump these together to hopefully make this a little more efficient for your review. Starting with items 1 through 9, those are fentanyl-related substances that have no authorized medical use. We'll add those, include those into Schedule 1 to follow the DEA. Item 10 are already currently Schedule 1 controlled substances on our controlled substance list, but to follow the DEA, they have scheduled those as well and we'll place the controlled substance code ID numbers opposite those. Item 11 is 2-methyl-AP-237. Another synthetic opioid that has no authorized medical use will include in Schedule 1. Items 12, 13, and 17 are a little unique in that these have been identified by the DEA as isomers of current controlled substances that we already have off the list. Since they're isomers, we're at language, but we need to list those with the controlled substance code numbers in order to make it easy for identification purposes. That'll also cut out any kind of interpretation there. Item 14, we have some items marked for cleanup there. And we're back revisiting xylazine with some additional language, specifically to add xylazine as a Schedule 3 controlled substance, as these have been utilized as an adulterant added to illicit substances on the street like heroin and fentanyl-related substances, complicating overdose in individuals. However, with these specific designations, excluding some following uses, which would be dispensing, prescribing, administering to an animal or drug containing xylazine that has been approved by the United States Secretary of Health and Human Services under the Food and Drug Cosmetic Act. Additional information there for manufacturing, distributing, or using xylazine as an active pharmaceutical ingredient approved under Section 512 of the Food and Drug Cosmetic Act, USC 360B. And then we have an issued as an investigational use or an exemption. We also outlined manufacturing, distributing, or using xylazine bulk chemical for pharmaceutical compound or licensed pharmacist or veterinarian. And again, other approved uses permissible under the Food and Drug Cosmetic Act, 21 USC annotated 301 et sec. Lastly, we have the one FDA approved controlled substances that we're adding is zuranolone, which is a treatment, an oral treatment for postpartum depression. That to follow the DEA, this will be included in Schedule 4. That will conclude the additions to the controlled substance list. I'll be happy to answer any questions you have.
Anybody have any trouble pronouncing those?
That's what I have to do on my spare time, is just say them in the air over and over again, so I don't butcher.
Look at our doctors in the room this side, are y'all okay with that?
I can say them, but not as fast.
Yeah.
Spelling them.
Exactly. So I really appreciate what you do and the areas that you cover, because there's a lot of detail and you can't miss those kind of things.
Yes, sir. And so fortunately, we have a good team of people, have great leadership that gives us good support with this. But also, we have work with our partners, Big Crime Lab and Poison Center, and any kind of identified substances. So they're a big resource and help to us as well.
Okay, so we're gonna need a motion to approve this list. Yes, sir. You got a question? Yes, sir.
On your xylazine, it said it's exempt when we dispense it to animals. What about the stock that is located in the pharmacy at the veterinary office? That is still going to be reported as a controlled drug there, correct?
No, if you're utilizing xylazine and you're in the process of ordering or maintaining it through your proper channels for that, those exemptions should be in place because we have that language in there. It's for the utilization, even the ordering of it.
Thank you.
I have a question. Mr. Day, could you tell us more about the postpartum depression drug?
Sure. There was one originally that was produced that was an intravenous infusion, I believe, called Rexanolone. This one is what they call a GABA amino butyric acid receptor A allosteric modulator, which is kind of similar to benzodiazepines and some of the other barbiturate agents. It's used over a short period of time when taken with a product. You have to have food with it, and it's done over a period of time. It's not a long-term treatment, but used over a specific period of time. I believe it's 2 weeks, and that's reevaluated. You can use additional doses, but I think it's for a specific period.
Would that be under the purview of a psychiatrist? And that,
It didn't indicate any kind of specifics. I would assume that if you're a specialist utilizing to treat that, as long as it would be in the confines of the prescribed information, it didn't indicate any specific practice. But again, that's a difficult scenario, but it's positive that they've got something real rather than having to go into a facility and having to be infusion. So
one more question. What about bipolar disorder? Is that too complicated for use in that?
I'd have to look on a specific contraindication for bipolar disorder. I'm not familiar with any kind of specific contraindication with that, but we can certainly get you any information or get you the prescribing.
Okay, thank you very much.
Absolutely.
Sure, a question for Dr. Bonner, actually. On xylazine, are the indications for its use clearly defined on the animal side?
Yes, it's used as sedative most of the time with large animal.
Okay, so are there any off-label uses that you see in your practice that aren't defined?
No, sir.
Thank you.
And I will state that this also mirrors very closely to the Combat Xylazine Act that was implemented by the federal government that looked at listed uses for xylazine. So we tried to implement that language should they go through, that there wouldn't be any conflict with what they put in there. We were just trying to be more comprehensive.
Let me retract that. Just say there are species, especially exotics and things like that, that don't have labeled use, that it might be used as a sedative, small ruminants and things like that.
My question in recent is under section 1, it's defined as been approved by the United States Secretary of Health, and if that has not been defined, and in theory you're using it on an off-label use, then it would convert over to Schedule 30. Is that correct?
That's a good question. Typically, when I was looking through most of the uses, it also has information in there for investigational use. So I don't know if that would fall under that purview. It would depend on the indication. But as far as for an animal, that kind of helps to broaden the scope of its use for an animal. We didn't define what type of animal there. So hopefully that would be more encompassing for you, so that if it was, we didn't define the specific parameters of its use, but for an animal. But we can certainly, if there was any questions, we'd be happy to look into whatever you had.
I'll make a motion to approve that rule.
Thank you, Dr. Morris. Anybody else? Second,
I'll second.
all in favor, say aye.
Aye.
Any opposed? Approved.
And the next item, I believe, should be the rules, state controlled substance rule amendments that we have presented before you. Specifically, page 8, language is updated, removing unwitnessed harmful doses of controlled substance sent to the pharmacy, the Arkansas Department of Health Pharmacy Services and Drug Control. This to help reduce confusion for our DEA registrants, specifically in hospitals and specific settings, as they would have processes to have those products viewed as wastage, and to decrease the amount of time that those are spent, unused products spent in those facilities that would have to be set aside in incentives. That would also help to align with Title 21 of the Code of Federal Regulations 1317. Item 2 is Part 1317 as far as the Code of Federal Regulations language. is updated, removing hospitals as required entities to surrender unwanted controlled substances to the Arkansas Department of Health, Pharmacy Services and Drug Control. Hospitals are DEA registrants and related facilities and are required to comply with the disposal process as outlined by the DEA in Title 21 CFR Part 1317. We also implemented the ACT language, removing the word regulation when applicable. And there would be some additional language that was updated as part of the codification process that we tried to implement with the Bureau of Legislative Research, removing words like and/or and replacing it with or other combination thereof. There would be some other examples of that in order to try to comply once that BLR codification process is in effect. It'll allow us to transition easier to that rule without hopefully catching those specific changes. We have to take any questions.
Having no questions, I'm not, on the motion to approve these rules. Controlled substances.
I'll make a motion. Second. What?
Yes. All those in favor say aye.
Aye.
Any opposed?
Yes, this was the end of our journey here for today. So we're seeking review and approval to repeal rules and regulations pertaining to synthetic marijuana products. These proposed repeal is to eliminate redundant rules prohibiting substances listed in Schedule 6 or the as we already have a extensive Schedule 6 number of items listed on our controlled substance list. We have to take any questions.
Any questions on this? Yes, sir.
From an enforcement standpoint, all of the penalties and all of that remain the same under the schedule as it would in this current regulation.
Yes, it should. As Schedule 6 has outlined criminal and penalties for possession and distribution and that sort of thing. So with that, my understanding is it would be the same, if not very similar.
Any more questions on this one? Okay. We have a motion to approve.
I so move.
Second. Thank you, Flame. All those in favor say aye.
Aye.
Any opposed? Any abstained?
Thank you.
Thank you, sir. All right. Mr. Paul. Glad to have you here again.
That on or off?
Yes, sir.
Again, I'm Terry Paul. I'm the Environmental Health Branch Chief of the Department. I'm here bringing you an update on more of a design rule related to, not to systems, what I think Mr. Crowder may ask, but the layout of RV parks and mobile home parks. Who knew in 2008, I mean, when this rule was developed, that was pretty sleepy rule. We didn't use it that much, but something happened in 2020 that turned this into a bit of a nightmare for me and for engineering and for plumbing due to some, I'm going to say some poor wording and some wording that needed updated really bad. But this is primarily an update of the wording, getting rid of things that no longer make sense, like a maximum RV size of 32 feet. We have RVs that are 50 feet now. It's quite interesting, some of these setbacks and some of these things that are in there. Basically, we're just cutting it down to bare bones, making sure the choices and the types of RV parks are apparent. And sometimes we have people who live in RVs as opposed to a recreational park, which is sort of the reality we've moved into now. So we're just trying to make sure we cover the waste disposal, the layout, and of course, eventually the waste disposal of these as best as possible. They do bring some unique problems with the plumbing code, with RVs or what I call catch and release. They're a little different than just a normal connection from home or a mobile home. So we're trying to cover all that, make sure we're getting things covered in this rule. And again, I think it's mainly just to simplify and get rid of old wording Some of you that, are my age or older may remember the term slop sink. Well, that is in this rule, so I want to get rid of that. That's a little outdated. Any questions? I'll be glad to try to answer.
Mr. Paul, line creator, I have a few questions. First, I do want to say thank you for updating this rule and the efforts that you and your staff have put forth on this. In reviewing this, I had a couple different questions. One, there, in my mind, there seems to be some confusion or potential gray area between, even though it looks like they overlap enough that you can't find the gray area easily, and that's the difference between mobile home park and recreational vehicle park. To that end, I was reading through the draft and then actually the draft language is presented. I had a couple of comments that I wanted to bring forward. One on the definitions of recreational vehicle park. And this is all through experience in Northwest Arkansas. We have a significant number, as you know, of RV parks that have popped up, been developed as for-profit RV parks because of the construction industry. So it is a semi-transient population. They could be there a year, they could be there 6 months or longer. But in that definition, number where I'm in recreational vehicle park, I'm not sure why we include the typically by day, or excuse me, typically by night or week, most commonly associated with travel to, at, or near an attraction.
That's where we were trying to distinguish, I had, a little help from legal as always. But we're trying to distinguish that a recreational vehicle park may be different than a place where people are living, where there's like you said, a business or something that's putting in something more temporary. But if it's set up for transient or more of a weekly, daily type thing, then it's going to need all of the other amenities that a recreational vehicle park would need, like the dump station, availability of water, those kind of things. So that's what we're trying to show. Okay. Now, there's a lot of parts of this that we never could regulate, but never really could. I mean, we couldn't go out and get on an RV park having a 33 foot long camper in it. But these are, the intent is try to separate those out, that we know which is which.
All right, thank you. Next question, it's regarding the central laundry facilities. We're down in section 5 now under sewage disposal. I know that doesn't fall specifically under the purview of the Department of Health and Engineering. And I still question, why. I think that's something we need to change. But right now, the language only says that the central laundry facility shall not be connected to the on-site wastewater system.
That's correct. ADQ has authority over laundry facilities. And that's been that way as far as I can remember. And there were some unique challenges of laundry facilities back years ago, before my time, in Little Rock anyway. And there were some concerns there, let's put it that way. Those decisions were made before my time. I don't keep up with that type of treatment, but that's where we're at this point in time. And I don't know if that's specific in DEQ's rule or not, but it's sort of like car washes. They've always handled the car wash issue. And most of what we deal with, again, is domestic waste. And we have an agreement with DEQ that if we're dealing with what we call industrial waste, which means other processes besides human waste or distinct waste, that goes to DEQ. But we're willing to work on any issue that we can.
Obviously, from a water quality and recreational public health concern, you can have just as much concern about how they're disposing of the waste or the effluent from a laundry facility, as a septic system. And so, to me, that's still an area that needs to be that needs to be worked on and hammered out a little bit. And then lastly, and it's just a quick comment, section 8 under plumbing. That very first line that says all plumbing shall conform with the current Arkansas Plumbing Code and Fuel Gas Code. I think that those are separate. Is that correct? Those codes are not. That's not a common code.
I believe they're two different
Deep codes.
They are cheap codes.
They are.
It is two codes.
Okay, so that would be. I want to make sure that I was misunderstanding that it was somehow now combined.
No, they're part. I'm sorry.
Okay. That's all. All right, thank you. You know, I've always got questions for you.
Terry, I have a question, probably just for clarity. We're referring to, the sewage disposed of and public sewer for one is accessible within 300 feet. That's still, I mean, we're still good with that.
Yes, that is state law, and that is, that was updated, I think, 6 or 8 years ago, by Andy Davis, and part of that was to clarify that there were cities that were attempting to get homes to connect on 10 or 15 or 20 acres, or businesses, when their business may have been 1,000 feet from the sewer line. And they may have had their property, but they didn't want to put in a 1,000-foot line. And so this was clarified. Now, the big kicker of this has always been accessible. And the term accessible, I guess it can mean different things to different people. But one of the ways you can look at it is you can't cross the Arkansas River, a train track or a major highway, or maybe go through a ravine that's 200 feet deep or something. So that's where we've always been with accessible. If there is sewer to a facility, meaning it can be connected and they're within 300 foot of the stub out to that on their property or on an easement, they have to connect to the sewer. And I believe that's up to the city or the utility to enforce that, not, I mean, it's in the rules, but it's also municipal rule. Thank you.
Mr. President,
Yes, sir.
don't need to take any more of the board's time, but after the vote, I have a quick question for Mr. Paul before he sits down.
Yeah, absolutely. Mr. Bond, we thank you for your expertise in the detail of this, but Mr. Kreider involved in the water and the other things that you've been involved with. This is prolific. This is happening everywhere. And I have never seen so much of it. Some of you might agree with that, but thank you for putting together some really response. So we need a motion to approve this. All right.
So moved.
Second.
Okay. All those in favor say aye.
Aye.
Any opposed? Thank you, sir.
Thank you. Mr. Paul, this is just a random question, but everybody else may know this answer, but I see a lot of abandoned mobile homes. Is there any rule that deals with abandoned mobile homes? They're an eyesore in the rural countryside.
What you'll find in most of rural Arkansas is there is no code enforcement. And there's just, most do not do that. Now, I'll say this, and then Mr. Kreider can speak this better than I can. When you get into dense developing areas where they start having countywide ordinances, maybe in Washington, Benton County, they may eventually get to that point where they can deal with those. But you're right, there's abandoned everything all over the state. And it really comes down to what your local officials can tolerate or can get approved, I'm going to say it that way, to take care of those instances. Sometimes if there's not a food source there, there's not a water source, it's usually not going to be what we would call a imminent health hazard or even a health nuisance at that point. Anyway, it really goes back to code. In Arkansas, it's not code heavy in rural areas at all.
So are you saying that's the county by county issue?
It can be, but I'm gonna say this, there's an absence of building codes in most counties in Arkansas. When you get out to rural areas, it's really and truthfully a buyer beware. If you buy 10 acres and build $1 million house, it doesn't mean the person next to you can't buy an acre and put in a RV to live in. I mean, just be real, but that's the fact, so.
How well I know, but thank you very much.
Wait, sorry, Dr. Rydell opened up just a small can of worms here. Great seeing you again, by the way. Thanks, Paul. One of my favorites here.
Oh, no,
So would this also apply in like municipalities where there are homes that are, and I'm coming, and I had alluded earlier to a, kind of a valid issue that I'm currently at odds with our city at, but we have a lot of homes that are basically abandoned, uninhabitable, they're not hooked up to, water, and people are squatting in them, and we're trying to find a way to get them knocked down, condemned, whatever it is. I mean, is this also apply at the city level, do you think?
Well, okay, this rule doesn't have anything to do with what Dr. Rydell is, okay? Let me clarify that. There, just about every city in the state is having this issue. We're dealing with more than one right now, trying to. Plumbing is dealing with some as well, but it's a common complaint. And I'll just try to brief and say this. Unless the city takes legal action, they have more authority generally than we do. And if they have codes and enforcement ability to go in and take action, they can do something. But it's still hard to forcibly remove someone if we can't take one of the amenities away from them. I got a complaint the other day where and Rick's folks are working on, they got cut off from the sewer because they wouldn't pay their water bill, but they're pumping water from their swimming pool into their house where they can flush, and it's of course going out on the ground. So we have all these bad things occurring. There is not it gets more difficult when you don't have anything to take away. Let's put it that way. That makes sense?
Our city, it does. Our city has a real problem with it, in my opinion. And also, do you know if there's any like grants or anything like that available through like an ADEQ or any of these other agencies that can basically come in and help demo some of this? It's really bad.
I don't think there is for an individual house, but I'll just say this, there are a lot of grants out of cities I would have nothing to know, wouldn't know anything about. You'd have to check with municipal league or somebody like that that might be able to help. Yeah, those are your avenues. Again, we get questions all the time from people that want us to do something. We have absolutely no regulation or authority.
Thank you.
Thank you.
Nobody had it. The reason this came up is that how interesting is this? I have a good friend in Alabama, and he says that Georgia, when they have mobile homes that have become eyesores, is where they take Alabama and dump them.
All right, so I appreciate the discussion. More, let's do it offline. Okay. We're gonna move right along. Okay. Committee of Plumbing Examiners, appointment of Master Plumber Representative, Mr. May.
Good morning. I'm Rick Mahan, Director of Plumbing, and serve as the Executive Secretary for the Committee of Plumbing Examiners. We have one of our Master Plumber representatives rolling off, and he served a 4-year term. The committee would like to list him for another 4 years. Brent Early, he's been a real asset to the committee. He's a master plumber. He has a business in Searcy, Arkansas. He's a graduate of SAU at ASU and out of Jonesboro, and we would like to present him as a nominee for second term.
So you have his information in your packet, so need a motion to approve it if you're so moved.
So moved.
Any second? Any opposed? All in favor, say aye.
Aye.
Thank you. Okay, so the next item is going to be handled by Brian Nichols. And this is regarding appeal by Curtis Rogers. Yes, Mr. President, and Mr. Rogers is here. I'll ask him to come. Can you have a seat there? Let's see, right there.
He's no relation.
Maybe, I don't know.
Sure.
Mr. President, members of the board, there was a hearing before the Committee of Plumbing Examiners. It was held on June 7th, 2024. And the hearing involved 2 violations of the Arkansas Code. The violations were engaging in occupation, plumbing and advertising out as a plumber. And also the second allegation was engaging in and installing plumbing without a responsible master plumber in charge. The committee heard testimony from Mr. Rick Mahan, who is the Director of Plumbing and Natural Gas here at ADH. Mr. Rogers was notified at the hearing, however, he failed to appear for the hearing. The committee took the testimony and evidence, and which was and relied upon that in making their determination. A copy of that is contained in the board packet, as well as a copy of the transcript of that particular hearing and the testimony of the Mahan. The committee ultimately determined unanimously that after consideration of the evidence that was presented, that Mr. Rogers did advertise and engage in the occupation of plumbing without having an appropriate plumbing license, and also engaged in and installed plumbing without a responsible master plumber in charge. Committee issued a civil penalty of $2,000. That was $1,000 for each charge, and also issued an order for Mr. Rogers to cease and desist advertising as a plumber. The advertising was done on social media posts, showing pictures of different things such as hot water heaters, installation, and I believe there was one of a whirlpool hot tub. Those photographs are contained in your board packet as well. That was relied upon. Now, as the board is aware, they can issue any decision that they choose to issue. We would ask that they uphold the committee's recommendation and its decision. Mr. Rogers is here, and I'll let him introduce himself. Speak.
Let me just say this before we start here. I want to limit your discussion to about 5 minutes. Can you do that?
I will do my best.
Okay.
I'm not sure if I can.
Well, I'll call it if you're going over to.
Okay.
That's how I'll do it that way. We want to get a chance to say.
All right, I wanted to, I'm sorry to start this by the way, appreciate it. The reason I didn't show up for the initial response was because I was out of the country. Secondly, this was kind of news to me. First of all, my advertisements were done by somebody that offered to do this for me on the website, actually from the Philippines. I had a customer from the Philippines who knew somebody. Anyway, I lost touch with that person and I was unable to take control of the website myself. Still working on it. In any case, the plumbing pictures that you're seeing there are from my own house. The hot water heater is from my house in Salem, Arkansas, which now my wife owns. And the hot tub and all the other plumbing things that you see in pictures there are from my house that I currently live in, and I send you photographs of the finished product. Secondly, I wanted to say that I had no idea, absolutely no idea, that a handy person or a general contractor, as I have been most of my life, was not able to perform changing out a faucet or a shower valve or a commode or anything like that. I always thought that was within the purview of a general contractor, handyman, or any other kind of thing that you would think. I mean, to me, it's a pretty simple installation deal. So I've done it all my life. I have installed close to 200 shower valves in my career in Texas. Apartment complexes and such where I've done them routinely, one after another, day after day after day after day. To me, it's just not ever been really anything to
And I've known many other people and other handymen in other states that advertise that they do this work. I never even thought to think about Arkansas not allowing a handyman to be able to replace a sink faucet for an older person that had other requirements in the house, and normally that's what it comes up. They need one thing and then it turns into this. They need some washers put in a faucet, or they got a leak shower valve, or this, that, and the other, and they want it replaced. There's literally 4 bolts to it. The reason this came to everybody's attention here was a customer that I had. We were kind of on good terms, friends. We had dinner together, and apparently I annoyed by calling out somebody that for what they were, who he had high regard to. So this in certain circumstances is all about a retaliatory issue as far as that's concerned. The shower valve, what he complained about and was telling me, or trying to tell the people here, was the shower valve, the shower valve was faulty, which incurred his hot water heater to stop working. Previous to that, before I started this job, by the way, his wife, girlfriend at the time, had already asked me if I knew why they had an issue with that hot water before I even got started with this job. So I know that was false from the get-go. I really don't know what to say. What I read as far as the laws were established in 2016 and 17, that's what I read. And then I figured I was grandfathered in because I've been doing this kind of work for over 30 years. I do not know anything else I can put towards you guys to tell you that, you know, if that is illegal for me now to change out a faucet or a shower valve or replace a commode, then the retirement community that I live in are going to be put out considerably because they can't afford to triple the cost of a plumber and such. And they do depend on me. I think at this time, I would also add that I did plumb and wire my own houses, my personal homes, not the ones for sale. And I did have them inspected by the city of Mountain Home in 2005 and 2006, and they passed without any issues whatsoever. That was both electrical and plumbing throughout. Also, let's see, it was GTW Construction in Fort Worth, Texas, that I did the over 200 shower valves for on an apartment complex there. And I guess I'm not trying to tell you my personal experience should have no issue, but I really was under the impression that I had every right to do what I did until this came up. That's all I got to say.
Thank you, Mr. Rogers. Brian, go ahead.
If I may just respond briefly, as Mr. Rogers is not a period person. At the initial hearing, I'm hearing a lot about all of this for the first time. Just a few counterpoints. It doesn't matter if he performed those pictures are from work done at his own home. The pictures were posted to his social media site under his Kurt's Handyman service. So it's the advertising of his business, the advertising department. It's not necessarily that it has to be at someone else's home. It's on a website that's advertising his business and his service. We're not certain. There may have been some changes in 2016, 2017, as Mr. Rogers alluded to, but the plumbing law has been in effect since, I believe, 1951 or early 1950s. So that argument somewhat falls on deaf ears, since the law's been in effect since before Mr. Rogers. And there are some exceptions for minor repairs, like changing faucets, but when you get into the more extensive changing valves and things like that, it becomes pretty clear that that's engaging in plumbing, you have to have a license. And that's all I have.
So the question before us is to uphold the committee's recommendations, findings, correct?
Yes, and our recommendation, if we would request that you uphold the recommendation, the fine, the cease and desist order, however, the board has to go to the issue and penalty they may choose.
Right, or we haven't heard Mr. Rogers been like an alternative to that.
Yes.
So let's open this up for questions of Dr. Daniels.
Is the advertising solely that website?
Yes, it is.
And he mentioned that he didn't have control of that website. Do we know if he created that, the pictures and?
Okay, basically what happened is a customer of mine from the Philippines introduced me to her sister online who did the website promotions. And she wanted pictures of the work that I'd done in the past. I give a friend of mine over here my photo album. She sent that various pictures, which one she felt was right to go into the website. Anyway, her and her sister have had a bit of a pull now. She can't get a hold of her sister right now, and I can't get a hold of her because the website was never put under my control.
But the question that you provided all the pictures that are in question on the website, they came from you originally.
They did, yes. Yes, I'm not.
That's all I wanted to know.
Yeah.
Thank you.
Okay.
If I may, I did, before we're talking about the photographs, that's, maybe I was wanting to check, and it does appear that several of these photographs have been removed. I don't do social media, so I don't know what committee spell on, as far as I'm concerned, out lawfully in somewhere. But there's only, I think, 2 or 3 photographs that are still appearing. Yeah, and those are somewhat questionable, but in any event, the others. But I'm not sure when they've done it as far as.
We have another question there.
For Mr. Nichols, as I'm kind of reading the record here, it seemed like there were multiple steps to connect with Mr. Rogers early in the process. You placed a phone call, an opportunity to discuss the complaint. There was an opportunity.
Excuse me, as you say, state your name.
Oh, Jim.
Because this is going on the record and may go forward.
Sure. It's Jim Carey. As I'm looking at the record, it seems there were multiple attempts to reach and engage Mr. Rogers with the initial phone call in which he stated, I do my own plumbing work. There was the opportunity at the hearing. I guess my question is, had Mr. Rogers availed himself of any of those other opportunities in this conversation? Were there other recourses available to resolve this issue?
In short, to answer your question, yes. There were attempts to reach out to Mr. Rogers, and I believe Mr. Mahan spoke to him, and that is the conversation that you're mentioning, about where it says he does his own plumbing. So then I didn't personally have any conversation with Mr. Rogers. No, Mr. Mahan did.
To that.
Just 1 second. No, so yes, there's always alternatives. I mean, there could be consents, there could be, we try to take people as last resort to hearings, especially if it's not something that we can know.
And then there's sort of a second question on that is Mr. Rogers here today has already sort of stated his intention to continue offering these services. So people depend on him, and there are sort of nuances in the law between, like you say, any and simple stuff. Is there a process through which Mr. Rogers can be educated or work with the department to continue to offer services that do fall within the scope of the law for his livelihood? What's that process look like?
He can apply and go to apprenticeship school and become a licensed plumber and work under the direction of a master plumber if he's going to be doing things for other people.
I believe you have to serve a 3-year apprenticeship for that.
Just 1 second, please. There is that possibility. There's that route to take. There's there's some minor exceptions for things that you can do, like changing out faucets. But if you're going to do any type of extensive plumbing work on someone else's home, the law requires you to be licensed. So that's basically as
It's my understanding too, that as a licensed plumber, there are substantial insurance requirements, bonding, there's a lot of, things like that, that protect consumers. You have, first of all, just the licensure, the standard of that, the ability to keep that, but even outside of that, insurance and sort of liability insurance, that kind of requirements to protect the consumers. Is that a correct assumption that those things exist?
I can't answer that. I know the ones I have seen since and insured also. Yeah. Sir, I am licensed and insured. I guarantee all my work to all my customers for as long as I'm breathing air, all my sons are. As far as the conversation I had, I recall somebody calling me up and asking me if I needed a plumber. That was so weird. And I said, "Need a plumber? I do want a plumber." I remember that response I made. I did not know it was from anybody over here or anybody to do with this case here, because it just kind of came out weird over the phone. I get a lot of prank calls and I get a lot of solicitations and things like that. And so sometimes I don't listen as much as I probably should on some calls, but 99% of the time it is somebody soliciting me for money or something like that. The other thing was, I'm not sure if anybody's familiar with what a shower valve is. It is basically a valve that comes in a package that you turn on in your shower, your hot and your cold water. It comes pre-assembled. You don't need to check if everything's correct inside there, no more than you do if you bought a new car and wanted to see if the engine's in there. It's there. I've never had an issue with that. There are 3 connections to most shower valves. There's the water that comes out to the top spigot, the hot water on the left side, and the cold water on the right side. You just hook those 3 things up, fasten it to the wall, and you're done. That's a shower valve. It doesn't take a genius to install a shower valve. Like I said, I've installed over 200 of these in the past, and I could probably teach my 7-year-old grandson how to do these. It's not extensive plumbing. I cannot believe that it would fall under that category.
I have a question for Mr. Curtis.
Yes.
You say you're licensed and insured?
Yes, I am.
What license do you have?
Right now, well, I used to be a licensed general contractor up until 2008 when the building went down. And then I got reestablished. I was going to semi-retire into a handyman business, which escalated. But I re-licensed as a handyman in 2008, sorry.
You have so you have
2018.
an Arkansas handyman's license.
Yes, I do.
I looked that up and I couldn't really find a definition of what that entails. Are you required to provide or to obtain any type of continuing education or do anything? And is that a yearly renewal fee?
Well, yes, and the reason behind there's not a lot to do with the handyman license, because I was also already had to prove evidence of my experience for the general contractor's license. That was still on record in the city that I was a licensed general contractor. So establishing a handyman license is much less of a degree than the general contractor's license. So by filling all the purview for the general contractor's license, I more than adequately filled the purview for the handyman license. Somebody establishing it from scratch that's never done it before would have to show experience in various different trades and recently performed.
As I understand the testimony, as I read it, the claim was that there was no cartridge.
That's correct.
Is that
that's the claim that was not true.
Okay.
And then I can go into depth with that on a personal level, but this had nothing to do with the plumbing issues.
One last question.
Yes, sir.
Then I'll go to, I think Dr. Torres is raising his hand here.
Okay.
There's a post on the website, picture that shows what appears to be likely 2 connections for a sink and the PVC drain lines.
Okay.
I'm assuming that is one that you submitted, it was post.
If it was on my side, it was probably my work. It could have been from even one of my new homes that I built for myself. And I had all that actually inspected by the city, and I can provide all that documentation. I'm sure they still have it on record there. But I had all the plumbing that was done on my house. The whirlpool tub is in my house also. The double sink vanity plumbing you see is in my house. I did my own shower stall, my own shower valves as I do normally.
Thank
Mr. Rhodes, thank you. Dr. Torres.
Thank you. Mike Torres, board member. First question to Mr. Nichols. You referenced how in Arkansas law or statute, there are differences between replacing a faucet and a valve. Is that correct?
It's my understanding, yes. No, I don't see it. That's something you
Well, I'm just answer. I'll agree.
answer that.
I'm gonna change the faucet to my own. Yes,
Mr. Manning, give your title for the record.
This Rick Mahan, Director of Plumbing, Natural Gas in the state of Arkansas. Our plumbing code defines or outlines final repairs, and it allows the replacement of kitchen sink faucets or lavatory faucets, the removal and replacement of water closets, which is a commode, and replacement of washers when needed in a faucet that's existing. But it does not include valves that are welded in or soldered in, fastened in. It's those are mixing valve that's regulated to prevent scalding, and it's just, that's where lime's from.
Specific to
That's
this.
in the definitions of plumbing, inside the plumbing code for minor repairs.
Specific to this case, but you say it was defined that this repair would be classified as a plumbing repair.
Yes.
Okay, thank you. And now a question for Mr. Rogers.
Yes, sir.
Based on that answer, would you answer define that what you did was in violation of Arkansas law?
I don't believe it was, no.
Why do you not believe it was not a violation if the repair was defined as a plumbing action and you hold no plumbing license?
Because this was a fixture. This is a plumbing fixture. This is not me doing plumbing in somebody's house. The worst possible case scenario, if you could do this completely backwards and absolutely wrong in every degree, is you're gonna have a leak. And that leak is detectable as soon as you turn that water on.
So it's your argument that you put in a fixture and not a valve, correct?
The valve itself is a fixture. It is a fixture. It is a shower fixture. It is no different than a commode, a sink faucet, the shower valve. These are all items that go bad over time and are replaceable.
Thank you, Mr.
Just a reminder to the board, this is an appeal. Mr. Rogers did not appear before the subject matter experts, the committee of plumbing examiners, sort of relitigating it because in fairness, which the board always looks to, and we want to give him an opportunity to express his thought. I think you more than adequately, in my view, given him an opportunity, but this was not presented to the committee of plumbing examiners, his testimony. I believe he stated he was out of the country. I don't know if there was a request for a postponement or there was no request for a postponement. So I think the board has done a wonderful job of giving Mr. Rogers, who's no relation that I know of, an opportunity. And so as the president has spoken in the beginning, he gave him 5 minutes, and I think we well exceeded that. So I just want to add that for the board's consideration.
Well, while you have the floor, I'd like to answer this question. So if, as we vote on this, we're voting up or down on specifically what? In regard to
The committee gave presented in your packet a proposed order. I believe it's a $2,000 fine, civil penalty fine. So whatever's in your order, the committee, the subject matter experts, has presented to this board the proposed penalty. Of course, Mr. Rogers did not appear and apparently did not ask for a postponement or ask for another hearing or anything of that. He appealed to you.
Okay, Rich, I appreciate you sharing that. Dr. Z?
I had a question. I'm a little confused. His personal homes, is this our rules and regs allow that?
Yes.
As in, what about even the valves versus
Anything inside your personal home, you can do.
that was my understanding. And I'm a little confused because he's saying he's done that in his own homes, but he's also doing it for hire for other people that it's not his property.
And that's where the violations from.
That's what I was in another session. My other concern is, I don't see going forward, if we uphold this, any declaration that he will no longer do or hire the same activity. Is there?
I'm sorry, sir. I'm trying to take all he said.
It's really for our attorneys. So you have to do the question.
Is one of them. But there's not each we respond to complaints. And so if there's another complaint, it would be investigated by Mr. Mayhan's investigator, and that would be brought for immediate plumbing exam. At some point, I guess there could be an opportunity to go to circuit court and ask for some kind of injunctive relief. But typically, we've not done that, to my knowledge. It's based on complaint.
Good question.
Mr. Chair, the finding of fact and conclusions does include that the respondent seeks to desist advertising plumbing services. So that would be part of the formal record of the decision here.
Thank you, Mr. Crowe.
But it's my understanding he doesn't have control of that. That's still online, or can others be seeking his services?
And if I may, sir, I am still, even by rules and regulations shown here, I am still allowed legally to change out faucets, which are plumbing. Commodes, which is plumbing.
Mr. Rogers, I've given you all the time. Okay. So we've got some other questions here. Yes, sir. Dr. Riddell.
Yeah, this is Mike Riddell, Dr. Riddell. I need some clarification. So if he were to say that I'm not a plumber, I'm a handyman, and he were to do the same sort of stuff that he's been doing for hire, is that a violation of our code?
Yes, violation of the law, yes. And what would happen is if we got another complaint to come upon it again, then we'd reach out, try to confirm whether or not it's been taken, that it has been taking place, and we might be right back here after another plumbing examiner committee here. So that would be the process. We would receive a complaint, and regardless of what the board's decision is, if there's another complaint, they would investigate it. And if there's sufficient evidence to support the allegations, then we would go forward with the committee here.
I'm really sorry to spend so much time on this issue, but I find myself somewhat sympathetic to him, but the rules are the rules. So I'm actually quite torn now.
Understand.
We have another question. Would you state your name?
Dr. Robert Bonner. One thing, this is not just I looked it up on Yelp. It's a business advertising app. So it's not a website that you just don't have control of. It's still active advertising through this business app. And I'm not sure if you're aware of how that Yelp works, but I pulled it up and there's still roughed-in plumbing that are no fixtures present at all, which may be in your house. I don't know, but we're still currently advertising plumbing on that app.
Next. State your name.
Clay Walensky, a board member. To whoever this applies to, $2,000 penalty that's been assessed, where does that money go? First question. Goes into the on back, I guess. Okay, back to the state, essentially. Okay. Second question, and have rental homes as well, and I have had a bathroom remodel and a shower that was improperly plumbed on a pretty expensive remodel at one of my rentals, and I've lived this, and I know this, and the plumber who was responsible for this, we reached out and came to an agreement, and so my next question would be, was the property owner made whole after this? And what were the steps that were taken to basically make them whole after this happened? It seems like there was a failure, and I have lived this myself, so I'm speaking from experience.
May I answer that?
Yes.
Okay, so
State your name again.
my name's Curtis Rogers. The client, my client, ex-friend that I did this work for, he proposed that the shower valve in the shower had somehow broken his hot water heater. And that he had said that the mixer valve wasn't installed in the shower valve when I installed it, and that was the creation of the hot water heater for some reason. I have no idea how that would work, but that was his complaints in any case. So the shower valve that I installed was brand new. And just to repeatedly say, you don't check under the hood for an engine in a new car, it's there, it's always there. Also, the plumber that he said that had told him this was Dewey Plumbing, who had plumbed several new construction homes that I built in the past, and I called him up on this, and he had no recollection of this. He said that he went over there to fix his hot water heater, but he had no recollection of anything to do with the shower valve that I'd installed. So the customer also then, as well as doing this here, he also brought a suit up at the local, what do you call that, Plains Court in Mount North. I'm not used to this, I don't go to court, I'm sorry. Anyway, he was suing me for what he paid Dewey Plumbing, I think was $200 and some odd to fix his hot water heater, plus whatever I charged in for the shower valve, I think it was $300. So something like $500, he was suing me to get all that money back from me. However, when he was asked in court for the note that showed that I was responsible with my shower valve damaging his hot water heater, he couldn't provide that. So when he couldn't provide that, the court gave him another term and said they could reschedule if he needed to get that paperwork together, this, that, and the other. And we rescheduled that court date for 2 months later or 6 weeks later. And when I showed back up at court, he didn't show up and the case was dismissed.
So the answer is no then.
But is
Well, the answer is
Let me say this, Mr. Rogers, is the answer yes or no?
to him getting,
Yes, being made whole by you.
did I pay damages I didn't do? No.
Mr. President,
Thank you, Dr. Daniels.
I think we're supposed to determine
Yes.
is the ruling from the committee,
Yes.
not whether or not Mr. Rogers did a good job or it was right or it was wrong. I'd like to make a motion that we accept the ruling.
Thank you, Dr.
I'll accept it. Thank you.
State your name.
Jim here, second.
So you heard the motion and the second. Now, are there any questions further on this before we finalize this? Okay. All those in favor, say aye.
Aye.
Are there any opposed? Any abstaining? Hearing none.
Thank you. We don't have any other business.
So what am I?
Thank you, Mr. Rogers. Your excuse. Dr. Rogers, please share with us these here, some session meetings. And thank you, Lane Crowder, for participating in these. I don't know who else participated, who else
Yeah,
participated.
Lane Crider, Mr. Ragland, and Dr. Chris Cathy, and
Thank you.
it was their second set of hearings this year, and they've done a magnificent job. This is very important, as you know, safe drinking public water systems is of paramount importance, but we have the Compton Water Works is the first, I believe, in your packet. A lot of the issues involved, have you seen earlier, having a certified licensed water system operator. You have that proposed order signed by Mr. Kreider in your packet. And so the hearing was on July 31st. We did have appearance by board members of the Compton Water System, Jerry Reagan and Gregory Vicari. And so you have the proposed order under paragraph 20, proposed administrative penalty of $228,000, 500 immediately, with remainder to be suspended contingent on them complying with the Safe Drinking Public Water Act and all applicable regulations. And so we ask for your approval of the proposed order of Compton Water Works. If there's, unless you have questions.
Question, Lord Bailey. I was just wondering, and maybe I missed it, but if in reading through the text here, it appears like they also failed to submit their annual monetary fees for public water systems. I believe that's set
The public water service fees, that's correct.
Yes. And I'm not seeing that in the captured in the penalty element of it. Maybe I'm.
As I recall, they paid that prior to the hearing. They paid up to that. Very good, about correct. Thank you. And that's why it's not there.
The hearing report, is there a motion to approve the findings of the committee in the Compton case?
So moved.
And
Lord Bailey.
or such a name, so we get this for the record. There a second on that?
Torres.
All right, all those in favor say aye.
Aye.
Any opposed? Move forward.
Second system, I always have to be careful how to pronounce it, is FALC Waterworks. And so, but it's one of my, I was so excited, the mayor of FALC appeared as a child. Y'all are too young to remember the Legend of Boggy Creek and the Sasquatch monster there, a famous movie. And so I got to meet the mayor and I digress. But anyway, so a hearing was conducted in July and we had the mayor, Terry Curtis of FALC. We had a discussion about the Boggy Creek monster, and he exists. I know the same as the woodpecker. What's that one that we came to, Ivoryville woodpecker? So I hope to find both of those in my lifetime. So there's an administrative penalty of $28,500 immediately due. Respondent shall pay the Department of Health past due amount of $4,461.60 for public service fees, and they shall publish all overdue public notices as required. And they were very agreeable. They apologized for having to be there. The mayor was most gracious. And so we had for approval of the FALC.
Is there a motion to approve?
Lord Bailey seconds.
Right. All those in favor say aye.
Aye.
Any opposed?
And this third one, we have against Hosanna Heights Water. The respondent did not appear, but being duly notified to appear. And I do not believe any representative is present. Is there anyone representing Hosanna Heights on the conference call video link? And I don't believe anyone's in the hallway. We have the excellent law enforcement officer here, and she can check, and she's the best in the country right there.
And I want to just commend you for having present. Thank you.
Yes, sir. Thank you.
Here.
For this all due to General Counsel Laura Shue. So we heard the testimony and evidence presented. We have an administrative proposed penalty of $137,280 with $500 due immediately. And they must, again, have a properly licensed water operator. That, again, that you've seen in the past, a constant issue, particularly in rural areas, of having a properly licensed water system operator. And also they must pay their past due amount for public service fees and publish all overdue notices. I believe they owe about $250 in past fees.
I hear a motion on this Hosanna Water.
Dr. Zini, I'll move.
Boyd. Second.
All those in favor say aye.
Aye.
Any opposed? Thank you.
Thank you very much.
Now, under other business, before we go, I want to say again, thank you for those that participated in the hearings, because those take a lot of time. And time out of your day and everything else involved with that. And I know there's a lot of water districts, and Lane, thank you for all you do. And then your expertise, I think, helps. So
it don't take.
Yeah, it pays really well, right? Okay, under other business, administrative updates, we got Dr. Bala. And Dr. Bala, can I limit you to about 5 minutes?
Yes, sir.
Okay, good try.
Yeah.
I said good try.
Is that a deterrent? I don't think that's.
In other words, keep it.
Well, I'll keep it by 4 minutes.
Okay, you can go.
So
Thank you, Mr. President. Thank you for being here. Thank you for presenting.
Sure. Thank you, Mr. President and board members. I'm really excited to present about the beginning of a new residency program at Arkansas Department of Health and UAMS, which I believe is going to move us as a healthcare system and public health more upstream in addressing some of the root causes of health problems we have in Arkansas. 20 years ago, we had started the effort through our College of Public Health in bringing public health training to the public health workforce and the healthcare workforce in general. This effort is focusing on training physicians on public health. And as you probably know, I think one of our former USS general mentioned that we have a sick care system, not a healthcare system, because our medical schools were heavy on teaching the medical students, residents, and the physicians and training on diagnosing and treating illnesses rather than going upstream in preventing the disease onset at the beginning. So to close the gaps, I believe one of the initial efforts in Arkansas was the formation of the College of Public Health. Where do I find this? So I'm going to, you can skip to the next slide. This board doesn't need much introduction about Dr. Joe Bates, who many of you may know was instrumental in bringing College of Public Health to Arkansas to train the healthcare and public health workforce on the need for addressing prevention in Arkansas. And he was a long-term mentor amidst several of his long resume, which I don't need to go over. As you all know, he passed last year at the age of 90. Next slide, please. And one of his wants during, as my mentor, was initially involved in bringing the preventive medicine residency program to Arkansas. Next one. These are some high-level bullets many of you are familiar with. Nearly 70% of our healthcare are spent on chronic disease treatment and management rather than prevention. And then I think our Surgeon General, Dr. Chandler, also mentioned about how some of the outcomes of poor prevention shows up in high maternal mortality. If you look at the maternal mortality in Arkansas, the leading causes are cardiovascular diseases and poor blood pressure control, obesity, mental health, substance use, and things like that. And also, of late, COVID pandemic has really, and other infectious disease outbreaks has really highlighted the need for public health preparedness and response. And preventive medicine physicians are uniquely trained both in healthcare and also in public health. Go to the next slide. Next one. And So far, preventive medicine, Arkansas does not have a preventive medicine residency program for trained physicians. Most of the physicians who come to public health either get trained along the way when they are on the job training, or some are fortunate to have an MBH or a doctorate in public health. Next slide, please. So you can go to all the bullets in that slide, Mike. So I'm not going to go over all the slides given the brevity of the time, but it's a joint program between the health department, College of Medicine, and College of Public Health. Next slide, please. And prerequisites, it's going to be a 3-year residency program, first year being the internship, and the second 2 years, the residents will be spending time both at College of Public Health and at the health department, getting their MPH and having public health rotations to have a good fund of knowledge about prevention and public health. Next slide, please. So just a broad overview, after their first year of internship, we proposing 2 residents per year. They'll be trained in, they'll get their coursework, they'll get MPH, and they will still have clinical rotation, 320 hours per year, or it's a 2-month rotation. It's going to focus on rural public health. They'll be working in rural health clinics or rural hospitals. And in their 3rd year, they'll have rotations in public health, focusing on epidemiology, biostatistics, outbreak response, clinical preventive medicine, environmental and occupational medicine, and all the public health specialties they need to be trained on. Next slide, please. And we are in the formation of an advisory committee. We got funding thanks to the leadership at the Department of Health, the secretary and our director, through the Arkansas $1 million. It's going to be funded. We're also going to seek HRSA funding for the longer sustenance of the program. Next slide, please. And these are some of the educational benefits I had already mentioned. Next slide, please. And that's about it. So I'll be glad to answer any questions.
Dr. Ball, I didn't mean to cut you so short, but anyway, the handouts are in your packet, but there's such a need for this. And so is there a national board for these positions? And are you a board member?
I am. So the program, there's an American Board of Preventive Medicine, which was started in 1958, before even several of the family medicine, emergency medicine. I think internal medicine may predate it, but as you know, internal medicine is now a specialty to train subspecialists rather than general practice. Less than 15% internists going to primary care. Most that's been taken over by family medicine, but preventive medicine has been started in 1958. I got my board certification through my fellowship at CDC. Our long-term plan is to bring a 3+1 program where people finish their initial board certification. I'm also boarded in family medicine. So if they are boarded in family medicine, internal medicine, they'll have an MPH. They can do 1-year fellowship track and get board certified in preventive medicine.
So when they come out of this, they're going to go where?
So they can, we ideally want them to stay in rural Arkansas. They can be staffed at the health department, College of Public Health, and all the rural communities, rural hospitals or rural clinics. The community health centers hire a lot of the preventive medicine docs across the nation. So there are some opportunities there in Arkansas, but we want our physicians to stay in Arkansas.
So is this one in the process of being accredited?
Yes, sir. So I'm working on the ACGME application right now.
How long will that take?
So it's going to be I have a 2-year timeline before the residents start. My goal is to submit the application sometime in the spring, with the site visit happening in summer, and then going through the NRMP matching process for the following year.
Very complicated.
It is a long path, but yes.
I think if you bring us up to date as things progress with this, I think it's a good move. And I'd love to have one down in a rural area.
Yes,
Medical appointment and local.
Exactly. Dr. Dale.
It's Dr. Bill, Dr. Ball, this is great. Thank you so much for this. Dr. Bates would be very proud, I think. So question is, you mentioned your goals, financially, what are your targets or your goals? And is it just limited to governmental entities, or are you seeking a grassroots approach as well for, contribution? In other words, if any board member wishes to contribute to this cause, how does that,
I will give my number. We can start endowment funding for that. I've been in conversation with the College of Public Health Dean to start an endowment for the future funding for the faculty as well on that. So, but it's in the preliminary stage, but I appreciate your question and your passion for that.
He would probably take an endowment if you had.
depends on how nice it is. That would be a great thing for the Board of Health to consider as a group, like the unique and significant contribution.
Yes.
Yeah.
That's a good idea.
Thank you. Get back on that.
Dr. Clay-Willisky, Dr. Balla, you know that we have discussed this and worked on this, and you know that since I've been a board member, obviously we had COVID in 2020 and that kind of shut things down. But since then, you have been absolutely tremendous in bringing this to the forefront in our state. That we have someone like you who is a champion for this, and people are beginning to wake up to this. And there is sort of this insidious relationship between big food, big pharma, and people being sort of functionally chronically ill. And this is something that's going to break us if we don't get it curbed now. And my motivation to you is to keep the foot on the gas, and let's keep going in the right direction. And thank you so much for all you've done. And Rick, you can say last to us. I appreciate it.
Thank you, Mr. President.
You're welcome. So, see, we took more time for questions and answers than we did. But anyway, thank you for what you've done. Appreciate it. Okay, under the division offices and updates, and we've heard, I guess, is there any comments from the public health science program? Anything more on that?
We do not have anything else under those items on the agenda. This is Laura Shute, General Counsel. I did want to make a quick announcement before your president's report at the end of the agenda, that just as a reminder, if you are interested in submitting your name to the nominating committee to be president in 2026, any nominations, any packets, any information that you want to share. Technically, according to the bylaws, it's due today, but we will extend that to Friday, post business Friday. So if you could submit that to the legal department, we would appreciate it. And we'll make sure that we conduct a nominating committee meeting in December. And any of those of you that are needing to be reappointed, make sure that if you're still interested in serving on the board, which we hope you are, that you get all of your packet information to the governor's office. And that's all that I have. If y'all have any specific questions about your individual reappointments or information that you need from the governor's office, just contact the legal department, contact me offline, and we're happy to help you with anything that you may need. That's all I have.
Thank you, Laura. So the secretary had to leave early. Did you have any comments? Is that correct?
Well, I didn't prepare anything, but in the discussion today, I just want to say thank you for everyone who spends their time reviewing these materials, wrestling with the hard decisions, working to understand the background information. I'm really grateful to each one of you.
I echo that. And, you know, we've got a great board. We've got a great team. And I can't say enough good things about the team because I interact with a lot of them. And Dr. Fleming, you have, I'm sure already, but you're going to do more in relating as you take over here shortly. But, and Elaine, I think you can echo that. Dr. Riddell as well. And you're part of the, you're still a part of the team out there, aren't you? Even though you retired, but you're still here. But I can't say enough about everybody that's here and what you do and helping the state because it's so important. And I want to comment on the symposium that we had, and Dr. Zahuri, put that together. But there were several of us that attended as board members. This is the first time the board members have attended that. And so, Dr. Zahuri, I'm going to give you a challenge for the next time we do this, to put the pressure on the board members to be there, because I enjoyed it. Dr. Fleming, I'm going to have him comment here in just a minute, so I'll put you on notice for that. So I got to see people that I haven't seen in a long time. This is a small state, and healthcare is smaller, you might say. And so living in a small world, it's all about relationships that we have and long-term relationships. And so I saw some folks that I haven't seen there that are now county health officers that it's probably been 30 plus years since I've seen some of them. And we had some long conversations. The other thing was that we had time to interact more with our team that works here and pours out their heart, blood, and everything into this institution to help all of our state. And so if we could get a date and plan for this the next time, I think you get it on your calendar. But it was very enjoyable, very informal and educational. And so I saw some things that, just interested me to the nth degree of things that are taking place in our state that I didn't have that much knowledge in it. And so it makes us more informed, more encouraged, and wanting to push forward in what's taking place. And our job and our relationship, and we have contacts out there that we can help support and bring things to bear to help this institution. And so I want to encourage you to do that next time. And again, I can't say enough about it. So I thoroughly had a great time. So
The dates are September 26th, 7th, and 8th next year. Last weekend of September.
Say that again.
The last weekend of September.
Last weekend of September next year. So put those on your calendar. Y'all got to be there.
I'm gonna make one last comment. To me, Dr. Gilmore is the GOAT. Greatest of all that.
Oh,
Excellent job.
yeah. Thank you. Dr. Fleming.
Yeah, for those of you that didn't make the symposium, you missed out. A lot of really good educational lectures and talks. It gave me a lot of insight into what these county health officers do. I didn't realize the extent of their involvement. So it really opened my eyes to a lot of, we're kind of limited here what we see in these short meetings, but what's going on out there every day with county health officers is a lot of work. So I appreciate that. You missed out on a lot of good bonding with meeting all these people, missed out on some good food and a great place to stay. So I encourage everybody next year at all possible to go to attend this symposium.
And I know all of you like education, or you wouldn't be in the fields that you're in doing the things that you are. But some of the things that we met, some of our new, how would I say, team members that I didn't know on the health department team and infectious disease and those sorts of things, talking about some of the stuff that you wouldn't hear about and how it's happening and where it's happening, those sorts of things. So it's important for us to try to do that. So get that on your calendar. I'm gonna push you all to be there. I'll be there if I can, if dates can count. Dr. Zinni.
I am a county health officer as well as being on the board. And I think the relationships that you develop, some of my compatriots were really pleased to learn more about the board and what board the makeup of the board and what all the health department does. It's a two-way street. We learned a lot as county health officers of what the health department overall does and some of our staff. That's another important part of the outcome of this. And thank you, Dr. Silver.
Yeah, this you can tell I'm excited about. This is going to make us better in the healthcare of our state. And we lag behind so many things, it seems like. But we met in the symposium. It was Friday night. We met Saturday, Saturday night and Sunday morning. So it's an educational program that you'll walk away from being enthused. So with that, take a motion to adjourn.
I so moved.
Second.
All right. Thank you all. Thank you.
I beat you. Not fiction.